Ruth, what is PTSD?
PTSD is really a very complex set of symptoms. But I think at the core of post-traumatic stress is that traumatic memories are usually relived rather than recalled. When people recall their trauma, they actually relive it and they feel like they're back at the scene of this. Of course, it has a dimensional sort of presentation. Some people lose touch with the present altogether, but others still have some touch with the present. When this happens, people can have two different responses. They can either have too much emotion and too much arousal, but there's also the opposite pattern of presentation when somebody gets back into their trauma and lives it. And that's emotional detachment, and their arousal doesn't increase significantly. So they're blunted, they're detached from their emotion, and often that's a survival strategy at the time of the trauma to actually get through it. And so I think it's really important to be aware of those differing presentations and also to be aware that people actually cycle between those two presentations. So go from too much arousal, too much emotion, to too little emotion and too little arousal. And I think the other key factor about post-traumatic stress disorder to be aware of is that we've moved beyond seeing post-traumatic stress just as a disorder of fear. I think for many years, we were really focused on the fear and terror that people can experience as a result of trauma, but we've moved beyond that, and we're very aware that anger, guilt, shame, are absolutely critical to the experience of post-traumatic stress. And of course, especially shame also drives that sense of self after trauma, often where individuals, I'm bad, I've done something horrible, and I deserve to